I think there's a lot of good out there. There are many good things going on, and many people are working hard, but we're not seeing it come together. And what I just want to see, especially in the space of health and ethics, is all the conditions actually exist for people to be okay. But the fact is that we are not okay because resources are not distributed fairly. There's inequity, there's hoarding, and we have enough technology, we have enough resources. Why are we not reaching the people who need them when they need them? My name is Caesar Atuire. I'm a professor of global health ethics at the University of Oxford and also an adjunct professor of philosophy at the University of Ghana. Right. Two things I'm working on at the moment. One is solidarity. What does it mean, or what would it mean if we took solidarity seriously in the global health space? I mean, solidarity is about identifying with other people and not just empathically, but doing something. If we understood health as something that we share, a common good, and we came into this space solidaristically, how would things change? I think if we took this more seriously, it would make such a deep difference. And I've seen solidarity at play in small communities, in marginalized communities, across different parts of the world, and how this solidarity makes them resilient to challenges and knowing that somebody always has your back. And I think we need, so that's what I'm working on, and seeing how to translate that into global health. Now, the other thing is, we're living in a world of radical value disagreement, so people are getting polarized. We don't talk to each other. We talk past each other or we shout at each other. And so I'm creating, together with other colleagues, platforms that will force people to learn the art of actually dialoguing across different opinions. Yeah. Bioethics for me is just how to make everything that is linked to health and well-being ethical. So it's about the ethics of things that are related to our life, our health, and our well-being. Therefore, it is not just only medical ethics or research ethics or public health ethics. It is also about the environment, our societies, how ethical they are, how are we fair to each other, how do we respect each other, how do we promote the well-being of those who are less fortunate in our societies. The white elephant in the room, which we often do not mention, is the pervasive neoliberal capitalistic model that is taking over everything. At the end of the day, everything or most values begin to fall when there is an economic value that is at risk. But we need to remind ourselves that actually the economy should be serving us. We should not be living at the service of the economy. And especially when it comes to well-being and health, what is at stake is a primary good. Health is a primary good. Without health, we can't even enjoy many other goods. And therefore, we cannot sacrifice this just to simple market economic logic. I think we are at a very interesting moment because, the systems that have sort of like dominated are being challenged everywhere. And they're being challenged even from sources that one did not expect. The challenges to be coming from. Think of the world global order. It was created by the United States and Europe. Really, the globalization. And now, these are the countries that are actually withdrawing from this, from the order that they created, and yet they're criticizing that same order. So, what is happening is that I think it's a kind of watershed moment. And this is a kind of window of opportunity to redefine. So, what will happen in 10 years depends a lot on how we redefine this moment. We can either redefine it by everybody retreating to their own shields, and that will not be a good solution, but by saying, let's rebalance power and still commit ourselves to working together, because the challenges that we have, climate change, diseases, all sorts of things, are such that we cannot work in silos. So we still need to work together, but maybe with a different logic.